Frontenac Kingston.
Mr. Speaker, my question is for the Premier. For the last few months now, we've been hearing an alarm every day of the second wave. The Premier, his Cabinet, and Public Health continue to spread a relentless message of grave danger that COVID is about to collapse our hospitals and our healthcare systems, and that we are in imminent peril. However, the Toronto Sun reported today that the total number of COVID patients across the entire university health network, with over 1,200 hospital beds, including the Toronto General, Toronto Western, Princess Margaret, and others. Speaker, can the Premier inform this House how many people are presently in these 5 Toronto hospitals with COVID, and how many are in the ICU?
Well, I can certainly advise the member opposite that you probably heard the modelling that was presented last week that indicates that we may be up to 6,500 cases per day in Ontario by mid-December if we don't take any action. That's why we did set up the framework that we set up to be able to move public health regions from one zone to another with additional restrictions, because if we don't take any action, we will be in the same situation as countries like Italy and Spain and other areas where their hospitals are overwhelmed. Right now, our hospitals are operating, most of them, at about 100% capacity, including some cases even a little bit more than that, but we know that hospitalization is a lagging indicator, so that as the number of cases climb, we're going to see the number of hospitalizations climb as well. So we need to do whatever we can to keep those levels under control, even as we're adding extra beds in the process.
Again, to the Premier, I believe the Deputy Premier is preoccupied with the projections and the models. In the Toronto Sun today, the facts are that there's less than 10 in ICU with COVID, and I make this distinction with, but not necessarily from COVID. Well, the Premier threatens ever more business closures and restrictions. In Hamilton, St. Joe's Hospital today, with over 1,200 beds, is reporting 2 people with COVID. Speaker, it appears the Premier may be slightly overstating or relying on only models that have proven to be false, because the facts don't reconcile with the message. How can we consider the total closure of major cities like Hamilton due to 2 patients in their largest hospitals? Speaker, my constituents are asking me, with the Premier's relentless message of alarm, is there proof or is it just...
Thank you. Minister of Health to reply.
Thank you, Speaker. In addition to the modelling that was presented, I can assure the member opposite that we are speaking to people on the ground each and every day within our hospital situation, in individual hospitals and within the Ontario Hospital Association. Yesterday, I read this, but I think it's particularly relevant again today, from the Ontario Hospital Association with respect to the changes that we made to our framework. The OHA thanks the provincial government for listening to the concerns of the hospital sector and its system partners, and for its leadership in responding rapidly to the alarming COVID-19 modelling data presented yesterday. Those are the facts. Hear, hear.